Uses. This medication is used to help relieve severe ongoing pain, such as due to cancer. Morphine belongs to a class of drugs known as opioid analgesics. It works in the brain to change how your body feels and responds to pain. The higher strengths of this drug, 90 and 120 milligrams per capsule, should be used only if you have been regularly taking moderate to large amounts of an opioid pain medication. These strengths may cause overdose, even death, if taken by a person who has not been regularly taking opioids. Do not use the extended-release form of morphine to relieve pain that is mild or that will go away in a few days. This medication is not for occasional, as-needed, use. How to use morphine sulfate capsule, extended-release Multiphase 24HR. See also warning section. Read the medication guide provided by your pharmacist before you start using morphine and each time you get a refill. If you have any questions, consult your doctor or pharmacist. Take this medication on a regular schedule as directed by your doctor, not as needed for sudden, breakthrough, pain. Take this drug with or without food, usually once daily, every 24 hours. If you have nausea, it may help to take this drug with food. Ask your doctor or pharmacist about other ways to decrease nausea, such as lying down for 1 to 2 hours with as little head movement as possible. Swallow the capsules whole. Adults who have trouble swallowing the capsule may open the capsule and carefully sprinkle its contents on a spoonful of soft, cool applesauce. Swallow all of the drug-food mixture right away without chewing. Then rinse your mouth and swallow the rinse liquid to make sure that you have swallowed all of the dose. Do not chew the mixture or prepare a supply in advance. Do not give this medication to a child this way, since they might chew the mixture and overdose. For children who have trouble swallowing the capsule, ask the doctor about using a different form of morphine instead. Because of the risk for overdose, do not give this medication down a feeding tube. The dosage is based on your medical condition and response to treatment. Do not increase your dose, take the medication more frequently, or take it for a longer time than prescribed. Properly stop the medication when so directed. The maximum recommended dose of this medication is 1,600 milligrams per 24-hour period. Taking more than the maximum dose might increase the risk of damage to your kidneys from an ingredient in this medication, fumaric acid. Before you start taking this medication, ask your doctor or pharmacist if you should stop or change how you use your other opioid medications. Other pain relievers, such as acetaminophen, ibuprofen, may also be prescribed. Ask your doctor or pharmacist about using morphine safely with other drugs. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. To prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor or pharmacist right away if you have any withdrawal symptoms such as restlessness, mental, mood changes, including anxiety, trouble sleeping, thoughts of suicide, watering eyes, runny nose, nausea, diarrhea, sweating, muscle aches, or sudden changes in behavior. When this medication is used for a long time, it may not work as well. Talk with your doctor if this medication stops working well. Though it helps many people, this medication may sometimes cause addiction. This risk may be higher if you have a substance use disorder, such as overuse of or addiction to drugs/alcohol. Take this medication exactly as prescribed to lower the risk of addiction. Ask your doctor or pharmacist for more details. Tell your doctor if your pain does not get better or if it gets worse. Side effects. See also warning section. Nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness may occur. Some of these side effects may decrease after you have been using this medication for a while. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. To prevent constipation, eat dietary fiber, drink enough water, and exercise. You may also need to take a laxative. Ask your pharmacist which type of laxative is right for you. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including interrupted breathing during sleep, sleep apnea, mental, mood changes, such as agitation, confusion, hallucinations, severe stomach, abdominal pain, difficulty urinating, signs of your adrenal glands not working well, such as loss of appetite, unusual tiredness, weight loss. Get medical help right away if you have any very serious side effects, including fainting, seizure, slow, shallow breathing, severe drowsiness, difficulty waking up. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching, swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Precautions. Before taking morphine, tell your doctor or pharmacist if you are allergic to it, or to other opioid pain medications, such as codeine, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of brain disorders, such as head injury, tumor, seizures, breathing problems, such as asthma, sleep apnea, chronic obstructive pulmonary disease (COPD), kidney disease, liver disease, mental, mood disorders, such as confusion, depression, personal or family history of a substance use disorder, such as overuse of or addiction to drugs/alcohol, stomach, intestinal problems, such as blockage, constipation, diarrhea due to infection, paralytic ileus, difficulty urinating, such as due to enlarged prostate, disease of the pancreas, pancreatitis, gallbladder disease. This drug may make you dizzy or drowsy. Alcohol or marijuana, cannabis, can make you more dizzy or drowsy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Avoid alcoholic beverages. Talk to your doctor if you are using marijuana, cannabis. Before having surgery, tell your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially confusion, dizziness, drowsiness, and slow, shallow breathing. During pregnancy, this medication should be used only when clearly needed. It may harm an unborn baby. Discuss the risks and benefits with your doctor. See also warning section. This drug passes into breast milk and may have undesirable effects on a nursing infant. Tell the doctor right away if your baby develops unusual sleepiness, difficulty feeding, or trouble breathing. Consult your doctor before breastfeeding. Interactions. See also warning section. Drug interactions may change how your medications work or increase your risk for serious side effects. This document does not contain all possible drug interactions. Keep a list of all the products you use, including prescription, non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include certain pain medications, mixed opioid agonist-antagonists such as butorphanol, nalbuphine, pentazocine, naltrexone, products that contain alcohol, such as cough and cold syrups, samidorphan. The risk of serious side effects, such as slow, shallow breathing, severe drowsiness, dizziness, may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems. Tell your doctor or pharmacist if you are taking other products such as other opioid pain or cough relievers, such as codeine, hydrocodone, alcohol, marijuana, cannabis, drugs for sleep or anxiety, such as alprazolam, lorazepam, zolpidem, muscle relaxants, such as carisoprodol, cyclobenzaprine, or antihistamines, such as cetirizine, diphenhydramine. Check the labels on all your medicines, such as allergy or cough and cold products, because they may contain ingredients that cause drowsiness. Ask your pharmacist about using those products safely. This medication may interfere with certain laboratory tests, including amylase, lipase levels, possibly causing false test results. Make sure laboratory personnel and all your doctors know you use this drug. Overdose. If someone has overdosed and has serious symptoms such as passing out or trouble breathing, give them naloxone if available, then call 911. If the person is awake and has no symptoms, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include slow, shallow breathing, slow heartbeat, coma. Notes: do not share this medication with others. Sharing it is against the law. This medication has been prescribed for your current condition only. Do not use it later for another condition unless told to do so by your doctor. A different medication may be necessary in that case. Ask your doctor or pharmacist if you should have naloxone available to treat opioid overdose. Teach your family or household members about the signs of an opioid overdose and how to treat it. Missed dose. If you miss a dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Storage. Store at room temperature away from light and moisture. Do not store in the bathroom. Keep all medications away from children and pets. See also warning section. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. For more details, read the medication guide, or consult your pharmacist or local waste disposal company. Warnings: morphine has a risk for abuse and addiction, which can lead to overdose and death. Morphine may also cause severe, possibly fatal, breathing problems. To lower your risk, your doctor should have you take the smallest dose of morphine that works, and take it for the shortest possible time. See also how to use section for more information about addiction. The risk for severe breathing problems is higher when you start this medication and after a dose increase, or if you take the wrong dose, strength. Taking this medication with alcohol or other drugs that can cause drowsiness or breathing problems may cause very serious side effects, including death. Be sure you know how to take morphine and what other drugs you should avoid taking with it. See also drug interactions section. Get medical help right away if any of these very serious side effects occur: slow, shallow breathing, unusual lightheadedness, severe drowsiness, dizziness, difficulty waking up. Do not crush, chew, or dissolve this medication or the contents of the capsules. Also, do not drink alcohol or use any product that contains alcohol while taking this medication. Drinking alcohol with this medication or taking crushed, chewed, or dissolved forms of extended-release morphine could cause a fatal overdose. Keep this medicine in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this drug, get medical help right away. Before using this medication, women of childbearing age should talk with their doctors about the risks and benefits. Tell your doctor if you are pregnant or if you plan to become pregnant. During pregnancy, this medication should be used only when clearly needed. It may slightly increase the risk of birth defects if used during the first 2 months of pregnancy. Also, using it for a long time or in high doses near the expected delivery date may harm the unborn baby. To lessen the risk, take the smallest effective dose for the shortest possible time. Babies born to mothers who use this drug for a long time may develop severe, possibly fatal, withdrawal symptoms. Tell the doctor right away if you notice any symptoms in your newborn baby such as crying that doesn't stop, slow, shallow breathing, irritability, shaking, vomiting, diarrhea, poor feeding, or difficulty gaining weight.